So today, let's talk about something that's undergoing a massive, seismic shift. A profession you think you know like the back of your hand. Pharmacy. And no, this isn't just about some new pills. We're talking about a complete reinvention of what a pharmacist even is. And we're going to use a really cool blueprint from Thailand called the Future Ready Pharmacist 2025 as our guide. Alright, so here's how we're going to break it all down. First, we're going to look beyond that old image of just dispensing pills. Then we'll dive into the patient-centered revolution that's really fueling this whole thing. After that, we'll peek inside the entrepreneur's inner toolkit, the mindset you need to succeed. Then we'll get practical and talk about designing the pharmacy of the future. And we'll wrap it all up with a 6-step plan to make it happen.
Alright, first up, let's kick things off by really questioning what we think a pharmacist actually does.
I mean, we all have a picture in our heads, right? You know the one. Someone in a white coat behind a high counter just counting pills. Well, that picture, it's quickly becoming ancient history. The reality of this profession is smack in the middle of a huge and, honestly, a really exciting transformation.
And this slide, this just lays it all out, doesn't it? It's the core of the change. We're moving away from the old way, which was all about the product, a totally reactive role of just handing over a box. The new way is all about the patient. It's a proactive mission to make sure that person actually gets the best health outcome possible. It's a huge difference.
So, what's really driving this revolution? I mean, why is all this happening now? Well, it's definitely not happening in a vacuum. It's a direct response to our increasingly complex healthcare needs. And, maybe more importantly, the growing realization that pharmacists are one of the most accessible healthcare pros we've got. The official term for this new philosophy is Pharmaceutical Care. And look, this isn't just some fancy buzzword. It's a real commitment. It's about taking the pharmacist out from behind the counter and putting them right on your healthcare team, working alongside you to get the best results. And check this out. This number really shows you why this is such a game changer. 1 in 4 people in Thailand go to a pharmacist first when they're not feeling well. That is an unbelievable accessibility advantage. Think about it. Getting a doctor's appointment can take days, right? But your local pharmacy is right there on the corner. That creates this massive opportunity for them to be the front line of care. And that accessibility, that advantage, is the launchpad for a brand new vision. The big goal here is to transform the local pharmacy from just a retail store into a true, integrated community health hub. You know, the first place you go, offering things like health screenings, counseling, the whole shebang. Okay, but here's the big hurdle. It's a psychological one. It's called the confidence-competence gap. Basically, pharmacists have all this incredible medical knowledge, but we, the patients, we just don't see it. And you know what? Sometimes they don't even fully see it in themselves. Closing that gap is absolutely crucial. So that's the challenge, right? How do you close that gap and grab these new opportunities? Well, it all starts inside, with a whole new inner toolkit. And the very foundation of that toolkit is your mindset. And this is probably one of the most important shifts anyone can make. The old fixed mindset says, I am what I am, which, let's be honest, is a dead end. Challenges are scary, failure is final. But the growth mindset, that's where the magic happens. It says, I can learn, I can grow, and failure, well, failure is just data. In a field that's changing this fast, that mindset is everything. Now, that growth mindset is what lets you build yourself into what's called a T-shaped professional. It's a great visual. The deep vertical part of the T, that's the hardcore clinical knowledge they've always had. But the horizontal bar, that's the new part. That's having a broad understanding of business, of finance, marketing, and tech. It's about being able to speak the language of other fields to really help the patient. Okay, so you've got the right mindset, you're building the new skills. Now what? How do you actually design a pharmacy that communicates all this amazing new value to the people walking in the door? This brings us to a really fascinating problem called the invisible value dilemma. Think about it. The most important, life-saving thing a pharmacist might do for you today is something you will never, ever know about. Like catching a drug interaction that could have landed you in the hospital. It's incredible, but it's totally invisible work. So how do you solve that? Well, there's this amazing strategic tool called a service blueprint. The best way to think about it is like a detailed map of the entire patient journey. And what's so clever
is that it separates what the customer sees, the front stage, from all that critical work happening behind the scenes, the backstage. Here's how it works. First, you map out all that crucial, invisible stuff you do backstage. Then, and this is the genius part, you design front stage cues, little physical clues that make that hidden work feel real to the patient. A great example is setting up a private professional consultation area. That physical space becomes tangible proof of the expert, confidential work happening just for them. It makes the invisible visible.
And of course, in today's world, technology is the ultimate amplifier for all of this. Telepharmacy can smash through physical walls. Modern management systems make everything run smoother. And communication platforms, like Line in Thailand, become the central hub for talking with patients.
So all these things we've talked about, the mindset, the skills, the design tools, they aren't just abstract ideas floating in the clouds. They all come together in a super clear, actionable roadmap that anyone can use to innovate in this space. And here it is, the 6-step roadmap. It's so logical when you see it laid out. You start by figuring out what your community actually needs. Then you build your skills, you design that service blueprint we just talked about, you pick your tech, and you make a real business plan. And the last step is maybe the most important. Launch, measure what happens, and then do it all over again, but better. It's a constant cycle of improvement.
And when you follow that roadmap, you arrive at the final destination. You're no longer just a place to pick up prescriptions. You become a vital, trusted healthcare partner, someone the community truly relies on.
And that just leaves us with one last question to chew on. This revolution, it's not a what if, it's happening right now. The blueprint for the future is out there. So the only real question left is the pharmacy on your corner ready for it?